also be aware about. As always, this session is recorded and will be made available through your e-learning library. We do apologise for the late start. There were a number of agencies joining us from around the country today, and also with dialing in, we wanted to make sure that people get the most of this session as well too. All resources that we use today and reference to today will actually be made available as well too, and will also be circulated directly to all attendees. Because of the volume of people joining us today, we do have a number of staff from our law firm helping with the chat lines and answering your questions. And with it, if you do have any other questions, by all means, we will be opening up the phone lines at the end of the session, and certainly we'll stay on the line to answer any questions that you might have. With that said, as always, we'd like to pay our respects to the elders past and present upon the lands on which we all meet. While this session is being run by webinar, we do pay our respects accordingly. With that, let's look at some of the governance reporting requirements that your agencies do need to consider during this time, and also the frequency of what these look like. And again, we will be providing templates for your agencies to use. One of the things that I will mention quite early on is that we do have a spread of agencies, some that quite openly have a clear disaster reporting template that they use, or disaster reporting plan. Some agencies are just finding out that they thought they had one, but it was under review, and due to a number of staff leaving, it never got done. We hope that with today's session, we can fill that gap. You may find that some of this information you may already have. Some of you might look at it and want to use parts or all of it as well too, and certainly that's what it's there to be done. So as I mentioned, we will be providing a template that outlines not only the key questions, but some of the key criteria that the boards and directors need to look at. We will also be looking at some of the frequencies of these meetings, and also what are some of the legal compliance requirements that your agency needs to consider. So with it, we'll actually start specifically with the overarching principles for directors and officers. In this case, really, when you look at all of the different Commonwealth and state government material, they talk about that governance and disaster management plans should guide you to ensure that your response for your agency meets at least these 5 criteria. It should be flexible and proportionate, that it can be scaled up or down as required. You may well need to be reliant on existing health systems within your networks. For example, you may not be providing acute or specific public health services, but you may need to link in with those or services within your agency. In terms of, you need to look at including agency clients, staff and volunteers and personnel, and look at what acts need to reduce any form of xenophobia, and that is particularly important in this case when we see that this particular virus has arisen from areas of China, and ensure that there isn't any dislike or prejudice against people from certain countries as well. And obviously focused on protecting vulnerable Victorians. If you're based in Victoria, this equally applies to other states and territories, but really looking at your specific catchment area. And also integrating with efforts across Commonwealth and other state government and relevant public entities. So this is part of the overarching principles for directors and officers. Now, there is pandemic legislation that will actually guide what governance obligations you need to meet and what specific plans you need to actually have in place. And this effectively will pour into the template document that I'll actually show you in a few slides. Now, one of the things that I will mention early on is that why we start with legislation here at this stage is because the way that the Australian legal system works is that any laws that are made by the Commonwealth, if they are inconsistent with the state or territory governments, then effectively the rule is that the Commonwealth government laws are effectively supersede anything that's said and done by the state or territories. It's part of the Constitution document, and it's important that I just reference that here, because this is what will actually guide us when we come to some of our governance plans. It is for this reason that it will guide us around why I will actually say to you, look, we actually need to override sometimes what the states will actually say to us, and where there is a particular inconsistency. So let's just have a look at this. I'll move through this fairly quickly because I do want to get to some of the governance reporting, because really that's what we're focusing on. This is not a session on pandemic legislation. So really, the Biosecurity Act is the first one. It authorises activities used to prevent the introduction and spread of targeted diseases in Australia. People are reasonably suspected to have a list of human disease specified under the Act, and if they are, they're required to comply with a range of biosecurity measures and requests for information. Now, one of the things that I will mention here, we've already had some questions come from agencies around privacy and confidentiality, and if they need to report certain data sets to the Commonwealth or state departments, do they need to do this? Under the Biosecurity Act, you do have a mandate to make sure that this actually is followed, and you are required to comply, not only your agency, but also staff and individually need to actually comply with this requirement as well too. The National Security Act 2007 authorises the exchange of public health surveillance information between Australia as well as governments, states and territories as well. And again, that's more about managing the monitoring of surveillance of the spread, in this case of COVID-19. International health regulations is effectively an international public health treaty that commits signatory countries, and Australia is one of those, to take particular action to prevent, protect against, control and provide public health response to the international spread of diseases. Now, the other one that I will just mention here as well too is the Therapeutic Goods Act, which establishes the framework for ensuring the timely availability of therapeutic goods, including medicines, medical devices, biological products, and making sure that they're acceptable quality and safety and performance as well. Now, equally, now we start to drill into the specific states. We're in Victoria, and the Victorian Public Health and Wellbeing Act aims to protect the health and well-being of the population. But what it does is actually give the health department the provisions for managing infectious disease. And importantly, the Act gives the Victorian Chief Health Officer powers and responsibilities for managing risks to public health arising from outbreaks of infectious diseases. Equally, for agencies that are either based in Queensland or New South Wales, or you have, there are a lot of agencies today that are joining us that actually cover the east coast of Australia. And again, you'll find that there is reciprocal legislation in Queensland and New South Wales, which basically gives the power to deal with public health risks arising from conduct of public authorities. Now, with it, what is important here is that under the Health Services Act, what the department can do is provide direction directly to hospitals around specific actions that those hospitals need to take. And this is where we will start to see some of the governance reporting obligations. For your agencies, you may also be directed, if you are in Victoria as a state, which we do have a number of standalone Victorian community health centres. We have a lot of Aboriginal health service and outreach services as well to disability agencies. Now, in this case, you may be directed, while you're not hospitals, you may be directed by the state to actually take specific action under specific contract arrangements that you have. And so while you may not be a hospital or health public hospital, effectively this can be still achieved by contract with your state department as well. What we also find is that for a number of AMSs or Aboriginal medical services, where you do have service agreements either with your state government, we're dealing with a number of agencies in New South Wales and Queensland where this is the case, where they've actually taken, because they fit into a vulnerable service population, then effectively the state has, the department secretary has required under its legislative powers to require you to provide certain information and also deliver and report against certain standards that you need to meet. And it's for this reason that you actually need to start to consider, if you haven't already, where your agency fits in to this profile as well. And with this is where we start to look at some of the governance frameworks and reporting obligations for your agency. Now, first of all, where these governance and reporting obligations, let's say, start from, it's easy to forget, first of all, that under the Corporations Act or CATSI Act, the duties of directors and officers still stand. So you do have duties and obligations to actually still meet. Just because there is a pandemic doesn't mean that everything stops, or effectively you ignore this altogether. Similarly, under the ACNC governance standards for charities, which all of you are, there are specific duties and general obligations that you need to meet. And I'm not going to go into those directly, but again, we've got a whole series of those under the e-learning library if you needed to refresh your skills on those. In terms of the governance documentation, now what we have looked at specifically around this is the Australian Health Sector Emergency Response Plan for COVID-19. This is one of the, I'm going to say, most referred to documents. It's also referred to under the Commonwealth guidelines. It actually references every single piece of legislation that I've also just referred to. That said, there's also the Communicable Diseases Network of Australia guidelines, which opens up and makes reference to specific infection practices, covering a range of areas from acute services, but more importantly, things like aged care and facilities management as well too, in terms of the guidelines and documentations that are available. Now, also what we've seen is that each state and territory COVID-19 pandemic plan, which we've just effectively summarised there, again shows and makes reference to the other two documents that I've also referred to as well. So really, when we look at some of the governance, when we talk of the governance documentation and what sort of reporting that your agency needs to look at, these are some of the main documents, and certainly there are others, but certainly these are some of the main documents that your agency needs to consider as part of this process. What we do have in terms of looking at the overarching responses is to look at just a reminder that the board's role, and you would have seen this from Institute of Directors recommendations and company policy documents, that it's really around strategic versus operational responsibilities. You need to consider, where does your agency sit within the state action plan, and what is your role within this as well too. It also needs to consider what is the proportionate response in terms of not just stopping all business simply because we have a corona outbreak or virus that's affecting Australia, but also looking at, well, what is your agency's response or goal in its decision-making process to achieve a response that is proportionate to the level of risk. It also means that you need to acknowledge that the risk is not the same across all your population health groups and your catchment area as well too. If you are an agency that has aged care services, if you're an agency that provides outreach work and other services to particular Aboriginal community service groups as well too. Obviously, the coronavirus, as it currently stands, has a higher impact into those particular population and client groups. You need to look at what response is going to be appropriate for the services that you deliver. Some agencies have actually taken the response to actually avoid, I'm going to call them outreach services or house calls where they can for staff, and actually do it via phone. In terms of communication and consultation, the management of the coronavirus outbreak will require your agency to keep in alignment with government and health sector industry, what I'll call standards or guidelines, but also look at communicating what your plan is to your clients and also network agencies. And this is really two overarching principles that boards actually need to consider, managers need to consider, and this is probably some of the higher level stuff that I'll actually just mention. It also means that as part of your communication strategy is to actually make consultation plans with other networks and responders in your area, and also look at who will be performing what essential services to inform the decision-making process. Now, there are really three plans or three parts of the plan that we have seen across this process. One is around the initial stage action plan, and I'll start to drill into this. There's targeted stage action plan, and also then the stand down action plan as well too. Effectively, before we jump in to see what some of these areas are and what are some of the reporting requirements that your agency needs to look at, let's just cover what this actually means. Now, effectively, the Commonwealth has provided guidelines on each of these three actions. Effectively, this is where you start to look at some of your disaster management planning in terms of what activities you actually need to look at. And so we'll actually drill from headings directly into some of the micro level requirements that you need to see. So in terms of the three-stage action plans, what we see is the initial stage, which really looks at initial activities, which will focus on minimizing transmission, preparing and supporting your agency's system needs and health services needs, managing initial cases that might be reported, not just within client groups, but also staff, identifying and characterizing the nature of how the virus is actually impacting on your catchment area, looking at providing information in terms of services to your own clients and staff, and also starting to look at what effective governance reporting you need in. And we do have effectively a document which we have put together to in fact start supporting you around this. With this, what you will find, and some of you have seen this, is that you do have as part of your policy sets of documents some of these areas that we've actually taken the Commonwealth guidelines and structured it for what each agency needs to have. In terms of the initial action stages, minimizing transmission, resourcing, starting to get your resources together in terms of, they call it the HR and stockpile. Where should these be looked at being deployed to for each storage site, and looking at your facilities. So it effectively drills into a lot of these areas, and as part of the webinar today, all of you have, if you haven't already got this information around this, I know a lot of agencies have asked for it in an Excel spreadsheet, and we'll actually provide that to you in an Excel format to help you put this information together. In terms of the other specific areas, when we move into the targeted stage action plan, this is really about ensuring a proportionate response, which is probably where we're starting to really get to now, and prepare when the Commonwealth starts talking about the COVID-19 effectively being managed all the way through, I think, till 31st of August was the initial date, and watching that bell-shaped curve that Scott Morrison was talking about. In terms of this area, what we're talking about here is ensuring you have proportionate responses, which covers some of your business effectiveness, service delivery, how you're going to manage your quality of care. In this, we've included things like credentialing and scope and emergency credentialing and scope of practice of staff, but also ensuring you have communications strategies to engage, empower, and build confidence across the community that your agency, I'm going to say, is in control, and I'll put that sort of in inverted commas. But also looking at how you're going to provide a coordinated and consistent approach within this particular stage. And again, what we have made available is effectively providing this checklist for you, which will allow you to actually manage this process as well. We have seen it, let me bring this up, for the targeted action stage. You may use other plans. What we have seen is by combining the Commonwealth information with the relevant state and also Communicable Diseases Association to actually bring this information together for you. Effectively, what you then have is looking at things like minimizing transmission. And of course, this is about supporting and identifying isolated cases, both within your staffing context and also your clients as well, and also ongoing case and contact management support. Across this, what we have added in is the relevant legislation areas as well too. So specifically around resources for HR and stockpiling, again, monitoring your agency's capacity and capability to establish triggers to identify when threshold measures have been reached. Now, what we mean by that is actually looking at, well, if you need to shut down services or facilities, what is your absolute minimum drop down levels for staff? In particular, when you look at some of the Commonwealth, and this is referenced throughout the state guidelines, they talk of somewhere in the order to 20 to 30% of staff will be affected. Now, if you run a small team, this could have, and all of the 20 or 30% are knocked out, that may well be a critical level. But what is your process to actually look at transferring some of those services to other providers if you can? This is certainly the case in aged care and elders facilities that we've seen already, where they may actually need to provide or actually reach an agreement with other providers in the area to consolidate some of either their resources or staffing support as well. In terms of looking at this targeted response, again, looking at clinical care and public health management, and effectively these dot points around identifying and encouraging the voluntary quarantine of close contact and suspected cases. And some of these items that we've placed in here is to really guide you to make sure that you've got at least the minimum requirements across your agency managed. You'll find that we have also updated your COVID-19 assessment form as well too. We've updated that to include quarantine, compulsory quarantine of any staff that have had international travel. You will find that we have actually extended that to include people that their immediate family or people that they live with have also been that have also met any one of those criteria, and that includes if they have been or recently come back from overseas. And this is where we've effectively got each of these checklists as well. With the next part, which we'll just cover briefly here, is around stand down. And again, the Commonwealth and states have provided directives on what this could look like. It is a little bit far away, but again, from a disaster management and governance reporting point of view, you need to have some sort of plan in place. Again, the stand down activities, it looks like these are scheduled to occur under current timelines from August or end of August onwards. And effectively what this means is, how do you support and maintain your quality of care, ceasing activities that may not longer be needed, and what's your transitioning options that you have for effectively winding back some of your disaster and governance reporting measures. Obviously, monitoring for a second wave of outbreak is important, and we've just flagged that within your reporting obligations and your document that that I'll just run through as well, and also monitoring the development of any pharmaceutical notifications which we've included, if they are being used, and if there is any other further outbreaks. It's important from your catchment area that you do look at the monitoring of outbreaks. We've started that from the initial stage action plan, which many of you have already implemented, and also looking at how you're evaluating and revising business plans as well. That said, again, the checklist that we have here for you is to effectively give you this particular reporting requirements, and you can use this to effectively cover across each of the headings and who's going to be responsible for what. So as I mentioned, this document will give you the information that you need around each of these three stages. It combines also the specific reports. You'll find that we've even got the section for legislation, because again, there may be directives coming from the Commonwealth or state, either around asking you for client information or even new legislative instruments that we have already seen in the last few days as well too, in terms of their notifications and powers being used. Now, once you do have these plans in place, you may also then look at using things like Excel spreadsheets or other documents which you can use. What we have done for agencies, and you can just see, for example, this is one of the ones as the demo sites that we have, you can see that effectively what we have set up, and this is effectively the Excel spreadsheet that I will send across to yourself. This is the, we will send this to you in an Excel spreadsheet format. But effectively, this is the disaster management system. Effectively, it is a managed Excel spreadsheet in many ways around it. You will find that what we have when we've set this up is under the initial project name, and this is for a particular agency, and we've just put in Community Health Service for here. The spreadsheet that I've given you, effectively what you should be looking at as part of your governance reporting is to look at the stage of where it sits, which is effectively this part here, who the lead implementer is. It may well be just your agency, or you may network into, as I mentioned, a hospital or PHN or other agency. You may need to look at the locations of where your facilities are, what the programs are, also what funding and budgetary amount is required for this, and what part of it is part of your annual budget to manage your health economics and disaster health economics around this. Each one of these stages should include a start date and end date. What we have done just in this case is taken the Commonwealth and relevant state government's plan, put this into the, as you can see here, initial, and I'll just make the screen bigger for yourselves. Here we are here. That's a bit better, thank you. Is to look at the initial action plan. The initial action plan effectively comes from this document here. It's the Word document that I've been showing you. And let me bring this up for you. So effectively what you have is the initial action stage that you need to look at. And when we bring this back, let me bring this here, we've divided it up into the 3 stages. Start date and end dates effectively slightly, the end dates do slightly overlap, as you can see. And this is because we just need to manage the risks around this particular part. But effectively, from a governance point of view, this will give you what you need to actually look at. Now, from here, what you can then do is look at the specific activities that you have. And what we have done is effectively set the details around what the initial activities you need to meet under this plan, and effectively what the indicators are that you need to meet as well too. And so you can see that from here, we've actually divided this across each of the initial action plan stages, and effectively each task has its own staff that are assigned to it, as well as what is the individual budgetary requirements that you need to meet. It also then means that if there are individual tasks that your agency needs to follow, especially if staff are based at home, then effectively you can get them to clock in and clock out. But either way, this information needs to be recorded from a governance reporting point of view, especially when it comes to reporting back to boards on whether you're compliant specifically with this particular part of the project and meeting your obligations in terms of your reporting. In terms of the next stage, when you go into it, you'll find that the same process is followed. Again, what we've got down is the targeted stage, and if I open this, then what I can bring up is the effective indicators. And again, I've got it that I need to minimize the transmission from this stage. If you're using some of you are using Excel spreadsheets or Word documents, which effectively can meet your requirements if that's what you choose to use. What you can see here is that you're able to minimize the transmission, and you can look at the specific indicators that you need to see. And also, if you have multiple staff running from multiple sites, then effectively you need a capability to effectively get this governance information back to yourselves. Again, you can, if I need to look at this, look at dividing each of these indicators up, going through and saying, okay, what is my strategy for minimizing transmission? In this case, I've got my definition, and I can then also look at, okay, it means that I need to isolate confirmed cases for staff members. I need to ensure quarantine and contacts is then made, and then case and contact information is managed. What you'll find from this is that, again, if there are specific milestones, and again, as I mentioned, we'll send this through to you in the Excel format if you like as well. If you want, we can switch this on and you can have a look at it, because it means then that from here, you can actually then manage and export effectively each of your areas. One of the things that we have seen from a lot of agencies is that there are unique indicators that are specific to your groups. So with that, what you can do is actually add your own indicator, and quite simply, like we always do on Gemba, if you want to add something, look for what you're looking at, click on the word add. Now, this is where your agency might have specific contract reporting obligations under each state and territory. And you can actually add your specific indicator sets that you need. And this will allow you to provide that information directly, and you can then also work through that. So let's say I had an aged care facility, and in this case, I wanted to measure the staff compliance with, let's say, drug administration. And with that, I'm going to put in the details here, and again, I can set the definition. This is for specific contract DHHS in this case, because they've asked us to do this. I can look at specific duration that I may need to do. I can fill in which measurement frequency I need to have. And in terms of identifying who is actually going to be responsible for this, I can then fill those details in and what the means of verification is. What you'll find is that I can then add that through, and effectively this will notify me about it. What you can then also look at is, which is important across each of these specific reporting obligations, if I bring these up, and again, this is something that you need to look at for your own governance reporting across each of these stages, is effectively what is going to be the staff member that's responsible for this, and also assigning staff to this particular process as well. And if I wanted to, I can actually update that directly from here. I'm opening this one because they've used my profile to create this person of Fred Flintstone. Importantly, for the COVID and coronavirus outbreak and pandemic at the moment, is that what we are seeing is that staff may be taken online and offline from time to time. And because of that, one of the big risks that you'll have to have a look at from your agencies is around managing the specific reporting process throughout this stage. If I can have a look at some specific take-home messages around this, is around reviewing your current board reporting format in line of the template that I have shown you, which is that Word document, as well as also these particular stages for your agency to have a look at. Look at what the timeliness of the response for each of these stages are. This will be driven depending on your agency's position within the disaster planning session and what role your agency plays, particularly if you are an acute health service like we can see already, or also if you are a standalone community health service, but also provide aged care services that we have seen in a number of areas across New South Wales and Queensland. Again, dividing it up into these particular action stages is important if you have not already done it, and also look at what is the specific division in terms of these types of key identifiers and how your agency is going to meet those requirements. In terms of, as I mentioned, the key deliverables, these are really meant based on the Commonwealth and state government reporting areas. A lot of agencies have missed the fact of looking at just the state as opposed to Commonwealth. Effectively, for your own agency, looking at where you fit within this will be one part of it. As I mentioned, for a number of agencies, actually a large number of agencies that are joining us today, we have taken these two documents and mapped them specifically for your agencies as well. We will be sending this information out along with the webinar and supporting documentation later today. These are the main key take-home messages that we are recommending, certainly from a legal compliance point of view. We will open up the phone lines and happy to stay on the line and answer any questions that people might have. As I mentioned, if you do have any questions after this webinar or want to raise it, by all means, please contact us on 1300 360 360, or you can email us at support@gemba360.com.